Good evening, everyone, and welcome to another webinar from the AIHD. So I would like to give a little bit of context on our webinars. So we started having the webinars last year. It is an initiative that we started last year. And so far, we've had a number of webinars, and we do them every 6 weeks. And for previous webinars, please find them at our YouTube page. It's called AIHD Media. So today we are having a webinar on stroke. It's going to be a webinar on stroke awareness. And we have our panelists associated or affiliated with the Stroke Association of Kenya. They are the partners that we have interacted with and decided that they would take part lead of this webinar. So I would like to go ahead and introduce our panelists. We have 3 panelists. So we have Edward Konzolo, who is the Secretary General of the Stroke Association of Kenya. He is going to be giving the introductory part of this webinar. And then we have Beatrice Wanjiku, who is a physiotherapist working in Nairobi County. She is going to take us through the context of what stroke is, the awareness part. She'll cover that part. Then we have Catherine Soe, who is a stroke survivor. She's going to give her story to us so that it can be relatable and we can get to learn from a practical experience. And I am Joanne Bochere. I am a program assistant at the African Institute for Health and Development, and I have a background in mental health. So without further ado, I would like to welcome Edward Konzolo to start us off with the introduction. Welcome, Edward.
Thank you very much. I hope you are getting me.
Yes.
I'm Edward Konzolo, Secretary General of Stroke Association of Kenya, which we abbreviated as SOC. First of all, I'm also a survivor who got stroke in the year 2012. So I have to give an overview of Stroke Association of Kenya, and I can say that in the year 2015, we came up with an idea of forming this association. I met with the man called Evans Nyambega, who is also a survivor, and we met in Kenyatta Hospital thinking of how we can get treated. So we had both gone there for physiotherapy, but we decided, because when we found many people, young, old, and people from different economic setups, and we decided, no, we should form an association. And therefore, the year 2015, Stroke Association of Kenya was born, and we had all finished with the registration and so on. So we've been on for 10 years and doing a lot in terms of awareness, in terms of advocacy, and so on. So we move from county to county, trying to show people what stroke is all about. And then the second thing I have to talk about is okay, by the way, Stroke Association is patient-led organization, but we have agreed and have associate members, and these are people, doctors and physiotherapists, occupational therapists, nutritionists, who are there to give us good information in terms of taking care of ourselves. Now, coming to the work, which is there on this very Sunday, on the 8th of June, we realized that Stroke Association, given that it's formed by patients, we do not have really that resources to make our voice even be heard more. So we decided to come over and form a group, to come over and plan for this particular day. This day is specifically for awareness. We want people to be aware about stroke. Many people are not aware, so they have to be aware. Secondly, it is a day that is, we can say, it's a family day for people to come and meet their doctors. They meet physiotherapists, occupational therapists, and so on, and talk to them for them to understand the causes and, if possible, how they can prevent this particular disease. Because anybody who has undergone through this disease will tell you that it is a very dehumanizing disease and so on. So the day Sunday is a big day for all of us. We expect people to come, and the questions that they have will be answered by the experts that deal with the stroke disease. So that is that about stroke, and the fundraising part of it is that come and you assist us in raising the money to make us at least move up and down, and make sure that nearly everybody has the information. Thank you very much.
Thank you so much, Edward, for that amazing description. And maybe to add, in case you want to go for the work and you've not come into contact with maybe the registration platform or the link, you can visit Stroke Association of Kenya's LinkedIn page. And I think as the session is going on, I'm going to put the link in the chat somewhere so that you can interact with it as we go on. So now we proceed to the big chunk of our discussion this evening. We're going to learn about stroke today, and we have Beatrice Wanjiku who is going to take us through that. So welcome, Beatrice. You can go ahead.
Good evening.
Good evening.
My name is Beatrice Wanjiku Mungai. I'm a physiotherapist. Thank you so much for inviting me in this forum as we talk more about stroke. And I hope you enjoy the sessions. Karibu.
Did I share?
Yes. John, you can share.
Okay.
Thank you. So that is the presentation for today. And my heading is stroke. So our business today, we're going to discuss about stroke in details, and I want to use the very simple terms. But in case I use a term that someone is not understanding, you can stop me and ask me for clarification. I'll be happy to do that. So definition for stroke. Yeah, so my definition for stroke. Stroke happens when blood does not flow to the brain. Ideally, for our tissues, our body is made of many tissues. and many tissues makes an organ. So brain is made of many tissues, and brain is an organ. So for us to survive, all organs requires nutrients and oxygen. So if brain is deprived of nutrients and oxygen, what happens is that this organ, this tissue dies. And for brain, if it does not get enough blood and nutrients within minutes, 4 minutes, 4 minutes is enough for a brain to get damaged. So it is very important for the tissue, which is the brain in this context, to keep supplied with oxygen and nutrients. And that is a diagram showing how the vessels, how nourished, how vascular our brain is. And in this context, we can go ahead. I've discussed 3 types of stroke. We have a type of stroke called ischemic stroke. We have another type of stroke called hemorrhagic stroke. And we have another type of stroke called mini stroke or transient ischemic stroke or TIA. Now let us discuss what ischemic stroke is. Ischemic stroke is the most common type of stroke. 87%, about 87% of the strokes that we see are of ischemic type. So with ischemic stroke, what happens? The brain, there's blockage in the brain. Brain is made of vessels, blood vessels. So in case a blood vessel is blocked, it can be blocked by a blood clot, or it can be blocked by a fat or a plaque. In case there is this blockage, at the point where there's the blockage, you block the supply of the oxygen and nutrients to the brain. So at that point where there is blockage, you will get the damage. So this blockage can happen within the brain, and if it happens locally in the brain, we say that it has a thrombotic. It is due from thrombotic clot. A thrombosis is a blood clot within the brain. But if this clot comes from somewhere else, like for example, in the deep vessels, in the legs, sometimes a patient may have a condition that limits them from walking. If they are not walking, what happens? Or if they're not moving their legs, what happens is the vessels does not supply blood, or the circulation is not happening in the vessels, where in the lower limbs, that is the legs, there's no circulation happening. So what happens? The blood in the legs will clot. So sometimes if a clot happens in the legs, it can travel to the heart and to the brain. In case the clot happens from somewhere else to the brain, we say that it has an embolism. So embolism is a clot that travels to the brain from somewhere else in the body. But ischemia or thrombosis is a clot that happens within the brain. So ischemic stroke is caused by clots. It can be a blood clot, it can be a fat clot. Hemorrhagic stroke. Hemorrhage means bleeding. Hemorrhagic strokes happen when the blood vessels in the brain ruptures and bleeds. So once the vessels ruptures, the bleeding happens. if a vessel ruptures, even if you hit your hand, for example, you see blood. What has happened? The vessels have ruptured. So in the brain, if a vessel ruptures, it bleeds. So that bleed, wherever the bleed has happened in the brain, it will follow a stroke. So the next type of stroke is called a transient ischemic stroke or a mini stroke. This is just a temporary disruption of flow. We say it is a mild form of stroke. This one resolves within days. You can move the slide for me, please. So that's a picture for the types of stroke. We have ischemic stroke, we have the hemorrhagic stroke, and the TIA stroke. So I've done the types of stroke. Now we want to see what happens, what follows or what happens after stroke. It is what is called pathophysiology of stroke. Pathophysiology, patho means pathology or disease. Physiology is function. What happens is pathophysiology of stroke. So what happens with ischemic stroke pathology? I mean, what happens with ischemic stroke pathophysiology? We've said that ischemic stroke is caused by a blood clot formation. Once a blood clots in the vessels, in the brain, in the large arteries, and we said this clot can be from a blood clot or it can be from a fat clot. And it can be within the brain or from a clot traveling from other parts of the body. So this blockage, it will cause reduction in the flow, depriving the tissue from oxygen and nutrients. And we've said that if a brain is not supplied enough with oxygen and nutrients, within minutes, 4 minutes is enough for a brain tissue to start dying. So when a clot forms in the brain, there are events, cellular events, a cascade of cellular events happens. The membrane, the brain starts losing its function because there's no oxygen, there's no nutrients. So what happens? It is not getting enough nutrients, it is not getting enough oxygen. So what follows is the function will stop, the function of the brain will just stop. If this function stops, the brain will definitely start dying. So it's a cascade of many events. I've said I want to do it in simple terms, and I will not go into details, but I hope you understand. So that is pathophysiology of ischemic stroke. A clot forms. This clot makes the brain failing to get sufficient oxygen and nutrients. So the next pathophysiology of stroke is hemorrhagic stroke. Hemorrhagic stroke, we said it is a rupture of blood vessel. So once the vessel, the arteries in the brain ruptures, there's bleed that happens. So this bleeding, once the vessel starts bleeding, they will surround the tissue. What happens? They will cause the bleeding will cause increased intracranial pressure. There's a normal pressure in the brain, but now we have a vessel that is bleeding. It will cause the intracranial pressure rise. And if the intracranial pressure, if the pressure in the brain is not regulated, or if it is not in the way it's supposed to be normally, if it raises, we consequently, we definitely get the damage. So I say that I want to do it in a very, very simple form. I do not want to go to details because I don't want to confuse people. But in case you want us to go into details, please let me know. So hemorrhagic is the bleeding. Once the bleeding happens, the pressure in the brain increases, and this causes further damage. We can move to the next. Mini stroke. Mini stroke, we've said, is a temporary. It is a transient ischemic stroke. It's a small clot that happens, but it resolves. That is why we said it's a mild or mini stroke, because it resolves. It can even resolve without any treatment. So let's move to the next. Now, we've discussed the pathophysiology of stroke. Now we want to know why do we have stroke? You see, I know we ask ourselves, why did I have this? Why did I have the stroke? There are so many risk factors that makes us get this disease. In some cases, it is not clear why you had the stroke, but in most of the cases, we can at least say, yes, I had this risk factor. So the risk factors, we have modifiable risk factors and we have non-modifiable risk factors. Modifiable risk factors are risk factors that we can change or we can treat. Non-modifiable risk factors are risk factors that you cannot change. We move to the next slide so that we discuss more. So the modifiable factors, we said they are modifiable factors are factors that you can change. You can control your high blood pressure. You can decide to stop using tobacco, or you stop exposing yourself from using tobacco. You can treat diabetes. You can control your sugar levels. High cholesterol, you can control your cholesterol with medicine. You can control being obese. Carotid arteries, these are heart diseases. You can treat heart disease. I've said transient ischemic strokes, the mini stroke, you can control, you can use medication to treat. So those are the modifiable factors. All right. Non-modifiable factors are factors that you cannot change. You cannot change being a female. You cannot change being a male. You cannot say, now I want to stop aging. No, you cannot. So they are called non-modifiable risk factors. And some of the non-modifiable risk factors that we have is age. As you age, you are at risk of having a stroke. 55 and above. Gender. Some researches say that males are at risk of developing stroke, although some other researchers are saying we are at equal risk. Some say female are more at risk of getting stroke, but still the more researches are being done. Hereditary and race. You cannot say I want to be born a black person. We are at risk. Black people are at risk of developing stroke. So a history, if you had a TIA, if you had a mini stroke, you are at risk of getting another stroke, either ischemic or hemorrhagic. Also, sometimes we have people who are born with abnormalities of blood vessels. Sometimes you are born with a narrowed blood vessel or a weak, your fibers are not strong enough. So you have abnormality of blood vessels, some aneurysm. Aneurysm is a narrowing. Those are some non-modifiable risk factors. So these risk factors are the things that make us get stroke. And sometimes other diseases like tumors, cancers, tumors of the brain, and so many other factors. But the common risk factors are the ones that we've just mentioned. Please, let's move to the next slide. So the signs and symptoms of a stroke. How do you know that I'm about to get stroke? And how do you know these are my signs? These are the symptoms of stroke. Number one sign is sudden numbness or weakness, especially on one side. If you start feeling sudden numbness, weakness on one side of your body, that can be a sign, one of the signs and symptoms. Confusions, or sometimes you're not able to speak suddenly. You're confused, you try speak, it's not coming out. You try looking, you cannot see, troubles vision. You lose, you sometimes you go stand, you lose balance, you lose coordination, and severe headache with no known cause. Those can be signs and symptoms of stroke. And to add on that, to make it more simple, we say be fast. Be fast. Signs and symptoms of stroke. Be fast. When you want to identify symptoms of stroke, use this word, be fast. B for balance. A person who is developing stroke will feel some loss of coordination. You lose balance. You have a problem with your eyesight. Sometimes you see a blurred vision or a blackened vision. Face, you have facial drooping. Arm, we said be fast. F for face, A for arm. If a person is unable to raise the upper limb, that is the arm, because of the weakness, that's a sign of stroke. Speech, as someone developing stroke, we've said you may appear confused and you develop difficulty speaking. Sometimes you try to speak and you slur. Then time. What we say is brain is time and time is brain. If you notice that out of nowhere, I've lost balance, I cannot see, my face is dropping, my arm is getting weak, and my speech is becoming slurred, please act fast, because brain is time and time is brain. We said within 4 minutes, your brain tissue is dead. So if you act fast, the early intervention stroke, the more you intervene early, the good outcomes, the more you get good outcomes. If you keep delaying intervening, bad prognosis and death, because once the brain tissue dies, we are who we are because of the brain. Our breathing is coordinated by the brain. So if you develop brain death, you're not even there. You're dead. So time, you have to act very fast. Notice this, and this is what we are telling the community. Please, if you notice this, balance, loss of balance, your eyes vision is you're suddenly not able to see. Your face has dropped, your arm has become weak, your speech has slurred. Please, wherever you are, act fast. You can act fast by giving CPR, calling the ambulances, get medical intervention from medical personnel wherever you are, and let us teach our community that we have to act fast. Brain is time and time is brain, and there's no other simpler way I can talk about it. Okay, so we move next. So diagnosis, how do we've said the signs and symptoms. Signs and symptoms can give you an idea of whether I'm getting stroke, but the diagnosis can be made through scans. You can do a CT scan or an MRI. You can have your blood tests done. You can have ultrasound for the carotid. Carotid are the arteries that supplies the brain. Or you can do cerebral angiograms, which are you study the vessels of the brain. They will show where there is clot and where there is bleeding. So these are the diagnostic measures that are done in case the doctor suspects there's a stroke. Those are the things that the doctor will use to confirm the diagnosis. So now we go to treatment. I've said with prompt treatment. People are saying out there, once you get stroke, you're done. No. With prompt, if you act fast, you will disable. I've said the earlier you act, the better the outcome. If you delay intervention, the prognosis becomes poor. So with prompt treatment, stroke does not have to be disabling. You do not have to become disabled because you got a stroke, or you do not have to die because you got stroke. No, please let us act fast. Once you spot these signs of stroke, seek help in the fastest way possible. Brain is time and time is brain. We move next. Yeah, brain is time and time is brain. Yeah, so within every minute, brain is made of so many cells. So many. You can see my pictures there, the images. So many cells are inside the brain. So every minute, if you develop a stroke, first minute, 2 million brain cells will die. Second, every minute, imagine. So by the time you're done in 1 hour, you've lost how many? Times 60. So the more you keep delaying treatment, the more you get brain cells damage or death. So let's go on. So the treatment we said that you have to do it very fast, and the treatment will depend on what caused the stroke. If the stroke was caused by ischemic stroke, we said clot. If the stroke was from clot, the doctor will give you the medicines that will, they're called blood thinners, medicines that will thin your blood. It was a clot. So there are medicines that are called blood thinners. They make your blood thin. They thin the clot. And in case depending on the severity, there are cases where the doctors decide to remove the clot surgically. So you're done a craniotomy and the clot is removed. Other cases for hemorrhagic stroke can be surgical management, and we say that hemorrhagic stroke is from a rupture. It can be from high BPs. So if it was from a high BP, the doctor controls the BP and you continue with other therapies. Then there is supportive care and there is rehabilitation, which is physiotherapy, occupational therapy, speech, language therapy, and psychosocial counseling. So that's the treatment that is done in stroke. We can move on, please. And prevention, we've already talked about the risk factors and the causes for stroke. Now we need to know, what do we do to prevent us from getting stroke? High BP, if you have if you've done your regular checkup, you go today, your BP is up. Tomorrow your BP is up. Next month your BP up. You need to control your blood pressures by starting your medications. So if you've been diagnosed at your diabetes, then you need to control your blood sugars. If you're smoking, you have to quit smoking or you reduce. If you do not exercise, you have to start exercising regularly. If you do not eat a healthy diet, then you also have to start eating a healthy diet. Then the next thing you have to do is that you have to take your medications as prescribed. The doctor gives you medicine and says, take this medicine 3 times a day. 3 times a day is after every 8 hours. You take 8 in the morning, After 8 hours, that is at 4, you take the medicine. Then again after 8 hours, because normally what people do outside, if they are told 8 hours, I mean 3 times a day, they will take in the morning, they will take in the afternoon, that is in the midday maybe, and at night when they are sleeping. No, that is not the way it's supposed to be taken. If it is it is 3 times a day, take it after 8 hours. If it is 4 times a day, take the medicine after 6 hours. So please, if the doctor tells you, if you go to the chemist and the doctor forgets to tell you, please take after 6 hours, take times 4. Divide you have a day is 24 hours. So divide the 24 hours, you divide with the number of times the doctor has said, so that we take these medications at the right time. We move on. So what are the complications following stroke? The complications that follows that you lose your movement, and it is called paralysis. The body is not able to function as it was used to. If your stroke happened in the right side of the brain, the left side of the body becomes weak. If the stroke happens in the left side of your brain, the right side of your body becomes weak. And that is paralysis. With stroke, paralysis happens only on one side of the body. If it happens both sides, then that is not stroke, that is something else. And also we have other complications, difficulty with speech. We said when we were discussing about signs and symptoms, slurred speech or difficulty in speech was one of the signs and symptoms. So if it is not treated, you continue having this difficulty with speech because your muscles are weak, your musculature, your oral and your facial muscles are weak. So your speech and your swallowing will also become difficult. Sometimes, depending with which region of which part of the brain is affected, sometimes there is memory loss. And also, a stroke makes people paralyzed. They are not able to function as they used to. And this which will make people develop emotional problems and some psychological disorders. Because normally someone is God created people to be independent. A patient was so independent with life, enjoying life, doing their own things. Then all of a sudden, strokes comes in. It makes them bedridden. They are not able to do their motor function as they used to be. They will develop emotional problems and sometimes severe psychological disorders. So those are some of the complications that happens. We can move on. So now, when I was doing this, when I was being approached, I was told that you're going to address women who are over 40. So my presentation wouldn't have ended there. I went deeper into doing a presentation for women who are above 50. Now, strokes are different for women who are above 50. And there are things, we said the risk factors for us developing stroke, but with women, it is different and deep for us. We are women, and God created us that way. We have hormonal challenges. We have hormonal changes post-menopause. Those are some of the things that put us into risk of developing other diseases like stroke. So why strokes are different for women above 40 is because as we age, there are hormones like our body has hormones. I know you're here, you must have heard that word hormone. Hormone are things that regulate our body functions. And we have a hormone called estrogen. estrogen is a hormone that has a protective effect on our heart. Now, as we age, this estrogen for women drops. And when we've said that estrogen protects us from getting cardiovascular diseases, heart diseases. So as we age, especially after menopause, our estrogen levels, women, I'm talking about women, our estrogen levels drops, it goes down. That means that you do not have that protective effect of developing a heart disease. So if your estrogen goes down, you are at risk of developing heart disease, and high blood pressure is one of the conditions that we develop. We also tend to have high cholesterol in our blood system, and we've said cholesterol and high BPs are one of the risk factors that for stroke. So we as women, we are at risk of getting stroke. Too bad. Another thing that puts women at risk is that science. This is science. They say women live longer than men. That the women has a longer life expectancy than men. And we've said as you age, our estrogen goes down. So if you're living over 70 years, by the time you are 70, our estrogen is down. So we are at high risk of developing those blood pressure, high BPs, and cholesterol. And that makes us, that's a very big risk for us to develop stroke. Another thing that make us women being at risk of developing stroke is, we've said that estrogen goes down and it has a protective effect on heart system. So sometimes we develop, they're called murmurs. Murmurs are the irregular heartbeat, the abnormal heartbeat. So we are at risk of getting the murmurs and arrhythmias because we do not have the estrogen levels. Again, this is also another risk for us as women to develop stroke. Too bad for us, and that is the way God created us. Also, as women, we have unique symptoms. We said there that we have, I talked about be fast as signs and symptoms, but for us women, we have extra. We also have other extra classical signs. We develop sudden fatigue, vomiting, nausea, confusion. For women, the confusion and disorientation is more common with women. We also tend to develop shortness of breath, hiccups, seizures and convulsions, pain in the face, pain in the chest, pain in the lips. These are unique symptoms that we as women we experience when we are getting stroke. So these are atypical symptoms, and sometimes we may ignore these symptoms because they are not common symptoms. We say that signs and symptoms of stroke is be fast, but now we as women, we have these atypical symptoms. You'll go to the doctor and tell the doctor, oh, I'm so fatigued. I sometimes I feel like I'm not breathing. I'm developing hiccups. You see, the doctor will not speak about stroke as a, not like when you went and tell the doctor, I've developed a loss of balance. I cannot speak. I'm not able to see. You see, but for this one, now we have fatigue, nausea, confusion. So we might be misdiagnosed as women. The doctor might treat us for something else, and yet it is a stroke that is coming. So it is good that we know these unique symptoms, so that when you go to your doctor, if the doctor doesn't consider a stroke, you can tell the doctor, hey doctor, there's someone who presented this for us. She said we have these unique symptoms in women. Can we check whether maybe it's a stroke that is coming up? So that is the unique symptoms we have as women. In addition, with the BFAST signs and symptoms, we also have these other symptoms. And that is it. So after a stroke, also, we as women, we have challenges during recovery. So I've talked about the symptoms and how we are at high risk of getting stroke more than men. So even the women experience these severe strokes than men. And we are more likely to have disability as women, and we may need long-term care as women. So these are some of the challenges we have. Then we move. Why do we have this challenge? We've said older women, sometimes we've said we have longer life expectations. We live longer than men. So it means, God forbid, my husband, maybe, God forbid, I've said, my husband, because we've seen science says that we have a longer lifespan than men. So my husband dies first. The kids are gone. I will remain in the house alone. Then, and because I'm aging, approaching to 70, 80s, I develop stroke. Who is there to look after me? Who is there to take care of me? There is no one. I'll be alone. Who will take care of me? I'll be alone. So I'm at risk of getting debilitated as a woman. Please, let's move back. Please, back again. Yeah, I'm still there. So we've said that those are the challenges we face during recovery. Maybe you're alone in the house, at home, because your husband died. We said that we have longer lifespan than men. Then the kids went, so you are left at home. You have you alone taking care of yourself. So recovery becomes harder. Who will take you to the physiotherapy? You will not have anyone to take you to for rehabilitation. So it becomes hard as women, we as women. And it is good to know these things, so that when that time comes, please let's seek help. Because I don't know what happens when we age. We do not want to seek for help. You do not want a nanny. You do not want to employ someone to stay with you. You even do not want to go and stay in your daughter's house or in your son's house, because you feel bad. I do not know why women do that. But the reason I did this, because I want to create awareness. I want to tell you, our mothers, we want to take care of you as women. So once you're in this situation, please let us seek help. Do not die alone uko mashambani. Seek help. And again, we as women, we are at risk of developing post-stroke depression. And post-stroke depression in women will make them not recover. We think so much. You do not want to go to your daughter's house. You do not want to go to your son's house. You do not want them to employ someone for you. So what follows? You will get into depression because you're not able to do the things that you used to do. You're not able to take care of yourself. So you will develop depression. So we are also at high risk of developing post-stroke depression as women. Let's move next. So the next thing I want to talk about as women above 50, the prevention strategies that we have. We said we have modifiable risk and non-modifiable risks. We can still prevent ourselves from getting this condition. And the prevention strategies that we can adopt are regular monitoring of your BPs. Make sure you're going for your regular checkup for your BPs and target to control your BPs. If the doctor has said you take your medications as prescribed. Do not take today. You see, the patients who comes to me, I ask them, so what happened? Why did you get this stroke? Oh, story mingi. Oh, I had high blood pressure and this is what happened. Okay, sawa. Are you on medication? I took the first 1 month and the pressures are now okay, so I stopped. Did you go to the doctor to stop the medication for you? No, I just stopped. Kwa sababu hata I saw now that my pressures are okay. Or sometimes they tell you, I went to church, the pastor prayed for me and the pressures became okay, so I stopped. Please, let's even if you stop your medication, maybe the doctor has told you to stop, make sure that every other month, you're getting checkup so that you keep your blood pressures in control. That is one of the prevention strategy. Another prevention strategy that we can do as women, heart health. Manage cholesterol. We said that with age, we are at risk of developing the high cholesterol and BPs. Also, let us manage our cholesterol through medications. Let's manage our blood sugars through medication. Also, the fib, the mamas, the arrhythmias. Arrhythmias are abnormal heart rhythm. Let us manage through checkups. We have to keep these doctors. We have to keep visiting these doctors for checkups because we are ready there for you. It does not cost a lot to get checked your cholesterol, blood sugars, BP, and the mamas. Mamas, you just listen with an stethoscope. We will be able to know where there's a mama, and we'll be able to refer to the right doctor, the specialist. Another strategy is that we live healthy. You see, at 50 plus, we say life starts at 40. So that is the time the kids have gone. You've educated them. You do not have a lot of burden at 40. So that is the time you want to take chipo, pizza, burgers, because now you have enough resources. You can afford. But even as we take these things, let us practice a healthy lifestyle. Yes, life starts at 40, but can we start our life? Can we start our lives at 40 healthy? Let us exercise regularly. If it is weight, if you feel like your weight is, to can manage our weight. If you're smoking, let us reduce smoking. Let us reduce high intake of alcohol. Let us live healthy. So healthy lifestyle is also one of the strategies to prevent us from getting stroke. Another strategy is diet. Let us focus on DASH diet. DASH diet means dietary approaches to stop hypertension. DASH diet. DASH diet emphasizes on people taking fruits, people taking vegetables, and containing lean protein. Kama ni protein, you want to take your protein, take lean meat, that is chicken, fish, and cereals. And then your diet, make sure your diet is low in red meat. We do not say that you stop red meat completely. No, you eat in moderation. So low red meat, salt kidogo too. Then avoid added sugars and fats, saturated fats. Another strategy, you regular checkups. You said you keep going for checkups, especially after menopause. You said how estrogen does to us, it goes down. So after menopause, let us go for regular checkups. And the other strategy, and I've just talked about it, let us adhere to medications. If you're on antihypertensives, do not stop if the doctor has not told you to stop. And even if the doctor said you stop, please keep going for your regular checkups. If the doctor gave you blood thinners, if the doctor has not told you to stop taking the blood thinners, can you adhere to the medication? So those are some of the prevention strategies we as women, we need to take up in these things. You need to take these things, you have to adopt these strategies and start practicing them. So my takeaway home is women aged above 40 will face distinct biological, hormonal, and social factors that will increase their risk for developing stroke, and this will complicate the recovery. So awareness, prevention, gender-specific care can reduce this burden of stroke, especially in this group. So, but that is my takeaway home, and questions are welcomed. Thank you.
Thank you so much, Beatrice, for that amazing presentation. It was comprehensive, and I think we have learned so much from it. I see our time has actually run out, but we cannot finish our session before listening to a lived experience. But that was an amazing conversation. We will not have time for the questions at this time. So I think I'll just go ahead and invite Catherine to give us her account. Catherine?
My name is Catherine. Let me just start this conversation from, can you imagine you wake up from a hospital bed and you can see all your loved ones around you and you know them. You can see your mother, you can see your sister, you can see your brother, but you don't know their names, or you can't remember their names, or you can't make out why you cannot articulate, or you cannot talk to them. That's what happened to me. I got a stroke in 2022. Before that, there was a lot of other issues before then. But in 2022, fortunately, I was at the hospital undergoing something else. And from that surgery, I came out with a stroke. And my stroke affected my speech, that part of the brain that deals with speech. So I woke up when I couldn't remember anything, like it was a glitch. I couldn't remember my name. I couldn't remember my ABCs, my 1, 2, 3s. And everything was in my head. So that was what was very frustrating, because I knew what I needed to say, and things like in my head, everything was just relating. I knew exactly what to say, but when it comes to speaking it out, now that was a problem. And so I am a journalist and I'm an on-air personality. I report for TV. So one of my biggest frustrations was that I couldn't do my job. And I was like, this stroke, how can God take away the one thing that is my job? What am I going to do? And that's when depression sets in. So when I left the hospital, my mother, who is a primary school teacher, came to live with me for 6 months to teach me. So because I had to relearn all these things, I couldn't remember anything. So she had to stay with me and teach me how to do all these things, teach me my ABCs, teach me my one, two, threes. And it was very frustrating. I was using not grade zero, those small school books. My 5-year-old nephew was learning. That's where I started, and I was going for speech therapy as well. And it took me, I don't know, it took me. I'm still recovering because there's a lot of issues when it comes to speech. And one of the things that I realized is that in this country we do not have adult speech therapists. Many of them are children therapists. So it was very difficult for me to get that service from Kenya. And the people that I was talking to, the therapists I was talking to, basically had to tailor make a lot of things to suit me and what I was going through. And another frustration is that my condition, because it's called aphasia. So because it's of a invisible condition, because I was not paralyzed, and when my speech resolved, and it hasn't completely resolved, but the fact that I cannot articulate myself the way I want. And when I speak to people about, well, I got a stroke and my entire speech was wiped out, and people would be like, what? But you're fine. You speak fine. And that's the thing. When you talk about invisible symptoms and people do not understand, when I cannot articulate myself or I cannot bring out my point, especially as a journalist, then people are like, what's wrong with this person? Like, I thought she's a journalist, right? And then I want to always try to tell them what I went through, right? And that caused me and causes to this day a lot of anxiety, especially when it comes to topics that I'm not very conversant on. I have a lot of social anxiety. I have been going to therapy to deal with that because I know most of what is happening with me is in my head. And my confidence levels went down, right? And it's only now that I'm coming out. This is the first time that I'm actually coming out, publicly to talk about my experience. And the reason why I decided to do this is because I want to talk to other survivors, caregivers, and just people who are interested to know when it comes to these terminal diseases and all these conditions like, stroke, even, cancer and things like that. We need to encourage each other. And if you have a story, because I feel like I'm over the worst, and I have managed to manage my expectations and say that, you know what, this is how I am now. And I'm at peace with that. So I want to encourage other people who, are recovering from stroke, people who are in a hospital bed, who are saying that, oh my God, my life is over, because your life is not over. I thought my life was over. And I started looking for other things to do because I said, I'm a journalist, I'm on TV and I cannot report. And right now I do report, even live on TV. I just need to manage things. So when it comes to encouragement, I just want to say that it's not over. People who are recovering from stroke and their caregivers, and there's so much support when it comes to family, and this stroke association that now I'm involved with. And I want to be able to, go even to the hospitals perhaps, and speak to people who are going through similar circumstances, to say and tell them that, look at me, it's been 3 years now, and yes, I have bad moments. Yes, I have moments when I feel like, oh my God, I mean, I'm just tired. I just want to crawl under, in the covers. But I know that I have to get up and just continue. And especially when it came to that speech situation, I had to do a lot of work. After the speech therapy sessions, I was told that, okay, there's nothing else we can do for you because you're healed now. So you have to go back home and continue. Like, it's not over. So I read a lot. I couldn't read. I couldn't make out the words. So I read a lot. I journal a lot. I eat very healthy, and I work out a lot. I mean, this disease caught me when I was very young. I mean, 45 years, and even the doctors up to now are trying to figure out what happened to me, because I've always been healthy. I've always worked out. I've always just done everything that is healthy. So they're still trying to figure out why. And like I said, before the stroke, there was a lot of things going on with me. So I feel like maybe because of those things that were going on, I don't know, something happened. I'm not sure. I'm not a doctor, but I feel it's that because my father died in 2021. My husband died in 2021. I got a mini stroke after my husband's death. And because I was in so much pain, I did not have time to process what was going on. And I just wanted to hide. And I hid behind my job. So everything they were giving me was, I put my hand up, and I travel a lot. So there was no time for me to breathe. And when I started getting the initial symptoms after my husband died, it was a mini stroke, and I was on assignment, and I could feel these symptoms because I had tingling fingers. I saw these double visions that Beatrice was talking about, but I just like, whatever, no. And on that particular day, I was in Rwanda, and I went to the gym. And when I left the gym, I spoke to my colleague, and basically I couldn't speak. I couldn't speak. Like everything, I couldn't even remember my phone password. And that situation resolved itself within about, I think, 24 hours. That situation went away. And we were debating, shall we go back to Nairobi or shall we continue in the deployment? I was going to DRC. But I, as Catherine, and I knew that something was happening with me in my body, but I said no, because I didn't want to deal with what was happening at home with all that death. And I just I did not want to come home to an empty house and things like that. So all those feelings, because the body talks to you, but I didn't let the body tell me that, you know what, you need to get checked. And that's how the bigger stroke happened. Because even when I came back to Nairobi and I went for some tests, and the doctor was like, oh, it looks like you had a stroke. And I was like, me? There's no way I can have a stroke. I'm so young. And they told me to be on bad blood thinners. And I said, no. I said, this is not I'm not going to be on that. Because I felt like, oh, they're lying to me because they want to use my insurance. So now I learned that everything I feel in my body, I have to take it very seriously. And that's what I'm trying to tell people, that everything, the body speaks to you. The body started speaking to me 6 months prior, but I did not listen. But anyway, I'm very glad that I was at the hospital, and I'm glad that I have a very good support network. I have a very good friend, and I also have a very good employer who gave me time to heal without too much stress. They gave me a whole year to recover. And when it comes to professionally, professionals who get sick, many organizations sort of after 3 months or 6 months and you're not recovering, they tell you buy golden handshake and things like that, and that's how people get very depressed, because they go home to nothing and they don't have a livelihood as well. So I had a very good, and I have a very good employer. I have a good network. So you have to have those kind of support system. Even when I'm angry, I know there are people who can call me and say, "Hey, Catherine, I haven't heard from you in, I don't know, in 2 days, 3 days. What's going on?" If I don't speak, there are people who can come physically to see if I'm okay or not. So you need that kind of support networks, and it's not because of a disease, but just generally as we age. Like you say, I mean, I'm 47 now, so as we age, we need that support system to go through a lot of things, including menopause and premenopause and things like that. So we need that. And just to finish off, it's all about encouragement. And I feel like whatever happened to me, because when I got sick, it's like God opened this blank canvas, and I'm still trying to find my purpose. I'm still trying to know the purpose, why this happened to me. And God has been speaking to me. It's just that I'm getting a lot of distractions, so I'm not hearing exactly what He's saying. But I know that I have a purpose, and this purpose is to encourage other people. I need to do this through my platforms. I have a very big platform as a journalist, and where I work as well. And I have worked for very, very, very many years. So I want to focus my attention on talking to people, creating this awareness when it comes to stroke, and just talking to people and their caregivers, and just encouraging them, and just seeing whatever I can do from my part to show that I am here. I'm still here. And that's what I have to say. I think my time is over or not. So that's me, and that's my story.
Thank you so much, Catherine, for sharing your story with us. I believe we have learned so much, especially in relation to what Beatrice was talking about. We've been able to see the connection where there are matches on that. And thank you for sharing your story. Like you've said, it's the first time you're doing it. So I believe that's also a big step towards the objectives that you have concerning your programs that you want to have coming up. So thank you so much for sharing your story with us. And I don't think we have any questions. And also, it looks like we've gone over time. But as we conclude, I would like our panelists to give us just one word of encouragement or information, just a sentence, and then we will finish. So I will start with the order of the way we presented. So I'm going to start with Edward. Please go ahead.
Mine is just to encourage my fellow stroke people that once you get stroke, that's not the end of living. We shall live up to the last time when God promised us. And also, I want to say that on Sunday, please, if you heard what even Catherine has explained, then you come and help us with our fundraising. Thank you very much.
Thank you so much, Edward. Beatrice, you can go ahead.
Oh, thank you so much. Mine, I would want to encourage and say this: it is not all lost. Recovery is a journey and gradual. It does not matter which stage we are at, what function has been lost, we can still do something. And I will give myself to you. In case you have challenges with motor function, please feel free to reach on me. We will help you go through. We will walk together through that journey, and let us support this movement. It's a good movement, and I also encourage you to come out towards fundraising this the walk on Sunday. It's going to be so helpful to each and every one of us, because no one is a candidate for stroke. We are all candidates. We never know we'll be helped the next time. Thank you.
Thank you so much, Beatrice, for that. Catherine, you can go ahead.
Well, mine is just to say, do not ignore the signs. The body talks to you. And when the body is talking to you, you have to listen to it. And I also want to say that, when it comes to physical, spiritual, and just psychological health, you need it. You have to make sure that you are healthy psychologically, physically, and spiritually as well, as we continue with this journey called life.
Thank you so much, Catherine. Thank you to all our panelists, Beatrice, Edward, Catherine. Thank you for taking the time to be a part of this webinar and for sharing your insights with us. And for the attendees who stayed till the end of the session, thank you so much for staying with us. And I hope you have learned a lot, as I have. I have learned so much. So without further ado, I would like to say that the webinar has come to an end. And I would like to remind us that please show up for the walk on Sunday. And without further ado, have a good night. And thank you for attending.